Thursday, September 18th, 2025. I hope everyone's had a chance to evaluate the previous meeting minutes. Do I have a motion to approve those minutes?
I move we accept the minutes as written.
I will second.
Okay, all in favor?
Aye.
Aye. Any opposed? Okay. As per our new protocol, we are taking public comment, that is general public comment at this time. We want to say the following: the Monroe County Board of Health encourages and welcomes public input. Written comments may be submitted at any time via email at boardofhealth@co.monroe.in.us. During meetings, comments related to specific agenda items will be heard after the board's discussion of that item and prior to taking a vote. At this time, we would like to invite those who would like to comment on any non-agenda items to speak. For those attending in person, please sign in at the front of the room. And for those joining us online, please use the raise hand feature to indicate you would like to provide comment. Each speaker will have 3 minutes, and we ask that you please begin by stating your name for the record. So do we have in-person folks?
Did you read the statement?
I did.
She did. She grabbed it. All right. Good job.
So do we have anyone in person giving public comment?
No, you don't.
And do we have anyone online? We do not. Okay. I'll hand it over to you.
Thank you.
Yeah.
Lisa, I apologize for
Of course.
being a little late. So you called us to order? We're
Yeah,
all
for 12 minutes.
legal. Hey,
Public comment, we've done that?
you approved the minutes?
Yes.
Did you introduce Dr. Teague to everyone?
Oh, I'm sorry.
No,
I did not.
that's
This is
okay.
Dr. Michael.
So our last meeting, we had a new board member appointed, but we were unaware. The message kind of missed us. So I would like to formally introduce and welcome Dr. Michael Teague as a new Board of Health member. And yay, hooray. We're really glad to have you, really glad you're here. If you wouldn't mind telling us a bit about yourself and why you're interested in this, and then I'd like everyone to just go around and briefly introduce
Sure,
yourself.
absolutely. So I'm Mike Teague. I'm a primary care physician in Bloomington and have been with IU Health for roughly 13 years. I'm also the physician leader for primary care. So one of the things I've been doing is a lot of the hiring of the physicians and the nurse practitioners and trying to address a variety of the access needs that we have that are across the country, but also, of course, very complicated here as well. So I do that a lot. I did my residency at Franciscan up in Indianapolis, and I did my medical school and undergraduate here in Bloomington. And so now I've lived in Bloomington longer than I lived in Indianapolis where I was born. So this is kind of my home. I really like it here. I'm interested in this just as I have been responsible for a lot of the primary care needs within IU Health throughout the region. This felt like a nice step toward being more available to help the community, because I view that job and take that very seriously, of the hiring of providers and trying to sort out a lot of the complicated scheduling issues to get patients seen and folks taken care of, from taking care of the chronic disease management, keeping them away from the hospital, all of that. This was a logical next step for, hey, I want to know what the county is doing. But also I think it's important for the county to know what we're doing as like the largest primary care group in the region. So I think I bring something to the table to try to help kind of come alongside together to work together to take care of the local community. So that's me.
Thank you. Welcome. Dr. Ryderband?
So I'm Sarah Ryderband, and I am the county health officer since January of this year.
Cool. Lee McKinley, I'm a retired internist and I teach for IU School of Medicine.
I'm Celinda K. Leach. I'm an old registered nurse, and I also have a background or a master's in public health.
George Hageman. I'm a retiree from IU, professor of microbiology and biochemistry.
Steve Pritchard, retired dentist.
See, we're glad you're under 65. Aurora Diorio, retired CDC.
Lori Kelly, Health Administrator. Dr. Lisa Robinson. I have my own private practice here in Bloomington, Joie Beach.
Okay, very good.
Family.
Great to meet all of you.
Thank
Just
you.
a comment on the retired thing. It does help to have a lot of time for this job.
Yeah.
Some of the meetings are,
Consider
some of the county
retiring
meetings
early.
Retiring early, yeah, that's right. I got about 25 years left, so.
Yeah. Okay, we do have a guest speaker tonight, and I am going to ask her if she wouldn't mind to take the hot seat there so that the owl can turn around and we can get her face on camera while she's speaking. This is Catherine Kat Zager, the director of the City of Bloomington Utilities, who was invited to speak to us about fluoride in the water after our August meeting when we all discussed, when Steve brought it up, you know, that we had a problem we were unaware of. And so she has come to fill us in a little bit more about that and allow us to ask some questions. So thank you very much for coming. We appreciate
Absolutely.
it.
Yeah, so Catherine Zager, Utilities Director. I just wanted to come and give a update on the current status of fluoride and the history in the last 5 years of fluoride in our drinking water, and then where we're going from here. So yeah, and then we'll take questions. So also, I'm a script person, so. Due to some leaks in our chemical feed system that supplies our fluoride, CBU has been unable to deliver the recommended 0.7 milligrams per liter of fluoride since the end of 2019. Our bulk tank, which is our larger, we have 2 tanks. We have a bulk tank and a day tank. Our bulk tank was relined in 2022 from a leak, but it continued to leak after that relining. Temporary delivery systems were tried, but they pose significant safety risks to staff. With the hydrofluorosilicic acid, that is one of the most dangerous chemicals we have at our plant. And so some of these temporary solutions were not fully safe for staff to operate. We're currently testing all of the components of our system to determine if additional relining of our 20-year-old tank will be effective. We're also exploring additional options if relining the tank is ruled out. Our goal is to have a safe, temporary, cost-effective solution finished by the beginning of 2026 so that we can safely continue the use of fluoride. Additionally, we have a capital improvement project that's slated for 2027 for a more comprehensive overhaul and assessment of the system, along with other chemical building improvements in our pending rate case, which was approved by the Utility Service Board and is now moving through City Council before it's seen by the IURC. In 2024 and 2025, we have reported on the minimum, maximum, and average fluoride levels in our drinking water as a component of the annual Consumer Confidence Report. This report can be found on our website, and our customers are notified of this report annually in their bills. Going forward, CBU is committed to improve our customer understanding of this document by presenting it annually at a regular meeting of the Utilities Service Board. In this meeting, we'll break down the report and help to explain each substance identified and its significance to public health. We welcome and encourage members of this board and the public to attend those meetings. And with that, I'm happy to take questions.
I'm wondering, because we have a dentist, and in my ignorance, I would say, why don't you just squirt some fluoride into that water, call it a day, right? I don't know. Right? So I wonder if you want to start or,
My question's kind of like yours of
okay.
how have other communities with similar issues addressed the problem other than to just put it into the annual report? Has anyone found a way in the outflow created a way of fluoridating that water rather than just having it in the tank?
So, I think it will help to further explain our chemical system. So all of our bulk chemicals are in what we call our chemical building. Those lines do run to the end of our treatment process. So the fluoride is actually being added when the system is working, it's being added at the end. And so, but the storage of it is in that bulk tank and then in the day tank. And that bulk tank having a leak is what caused the problem. I don't know how familiar folks are with hydrofluorosilicic acid. It's extremely corrosive. And we believe what was happening is it was corroding the tank. And since we've had multiple leaks with this bulk tank, it's corroded the concrete underneath the tank as well. Which is why we are evaluating whether or not relining it will actually be effective.
And are there ways that other communities have addressed this issue?
So as far as the ways other communities have addressed this issue, when you say this issue, do you mean the issue of fluoride?
And making sure that it's not eroding the tank that's holding the chemicals. I mean, there must be a way that other communities fluoridate their water.
Oh, yeah, absolutely. So regular maintenance and updating of tanks. So I don't know the actual average lifespan of your typical fluoride tank, but I know that ours is reaching that. And so it's just a costly matter of replacing tanks, replacing lines, replacing pumps. And that is how I assume utilities who continue to fluoridate their water manage it.
So it's not a metering problem, it's a storage of the concentrated form of the fluoride that gets pumped into the water to give the effective concentration. But yet it has been going up and down.
Mhm.
And when you take a tank out of service, you think it just goes.
So we do, that's a couple of things that were happening. So one is that we have background fluoride in our water. That's just naturally occurring fluoride, and that is around 0.1. So it doesn't quite get up to that 0.7. That is the recommended level, which is why we add more. So that fluctuates around 0.1. And the other spikes that you would see, I think there was a graph that was published that we provided actually to Dave Askins. That graph showed like spikes, but it never quite got up to 0.7. That's when we were trying our temporary solutions. And so that temporary solution looks like a tote. And that tote is hooked up to a pump. It's like, I don't know if you've ever, I used to bartend, and you would change a keg and you would put that, and sometimes it would spray out. That's kind of how you would attach these totes. It wouldn't always spray out, but that was a possibility. And so that was a safety concern because, we were having spills associated with changing out those totes all the time, and we weren't able to keep up with those smaller totes.
My,
Only problems.
my concern is the dentist.
Mhm.
Did they know that there wasn't an adequate amount of fluoride in the water when they treat your teeth? I mean,
I don't know what dentists
No.
know.
I do know.
Turn to the dentist.
Yeah.
I do know what
They
they
not have
know.
been notified somehow. I mean,
Yeah, which
Yeah.
gets to my main question is, if this problem's been going on for 5 years, is there some reason why it was never reported as a public health issue to the health department or to the dental community? Because this is a serious public health issue.
Mhm.
I mean, and again, low income people are disproportionately affected because they may not take their kids on a regular basis to the dentist. Because only 40% of the people go to the dentist anyway. And this results in significant cost. The dentists aren't aware of it, so they're not trying to, compensate for it by topical fluorides or suggesting drops or something at home. So I guess that's the thing that really bothers me the most. I mean, this is 5 years, so that's a whole set of kids' primary teeth on one child that maybe had no fluoride. And the second thing is that you know, the fluoride levels reported in the water are misleading because it shows, if you read across the top, it says it's the highest reading, which means, well, sometimes it was 0.7, but if you look at the fine print at the bottom, it was 0.3 really. So why wouldn't you want it to reflect an average reading for that year? That seems to me to be a more accurate reporting.
There is a mandated way in which we have to report. So that.
Well, then why wasn't it reported for 2 years in our annual report?
So let's talk about reporting. So it was not actually, I should have had it in front of me, but in 2024 and 2025, it was reported as part of our consumer confidence report. And like you said, it showed the max, and then in the fine print had the average and the minimum, right? Before that, it was not reported. And to be perfectly honest, I was not the director at the time. It was another administration. And we thought that at least restoring it back to our consumer confidence report, because, and this is an assumption on our part that we assumed people were reading this. And, you know, I really want to encourage people to read this consumer confidence report, especially, you know, boards of health, dentists, people concerned about what's in their water. And so if people have a concern about what's in their water, they should read the consumer confidence report. And it wasn't reported in that for, I believe, 2 or 3 years before I became director. And that was,
I think it was 2 years.
2 years, yeah.
2 years. It had no.
It was not reported at all for 2 years before I became director. We put it back in our report because we thought it was the right thing to do. We should have probably done more push and education. Yeah, sorry. It was a tough position to come into an existing problem and you say, okay. Sounds like some knowing nods over here.
Yes, we understand your position.
Yeah.
Gee, our administrator understands.
Is there a hierarchy, like for instance, if there was gross contamination, you'd have a boil order or something crazy, and then if there was call farms at a certain level, you might. Is there anywhere on that continuum where fluoride is? Is it somewhere on that list? So could it be added to that list of things that we are notified by at the time and when it happens?
That would be a local change. There's no state level like notification system because the presence or absence of fluoride, while still a public health issue, does not have impact on the potability of our water and the safety of our water. And so those types of notifications we've reserved for safety issues of our water, as far as like, is your water safe to drink right now? And you know, even though it is not as awesome without fluoride, it is still safe to drink. And so you have to be cautious as a water utility to not alert the like to not alarm the public when like they don't necessarily may not fully understand.
How many other things are added to our water that don't have to do with safety of water?
See, I would say like fluoride is the only real additive to the water. We do have chemical processes in the that are added during the treatment of our water that are used to treat things like taste and odor. So for example, we add carbon during the summer to address taste and odor. That's removed through the treatment process. So I would say as far as like additives, fluoride is.
Yeah, so
yeah,
it being the only one, I think that it wouldn't be an onerous position to report when that is chronically low.
Yeah.
I mean, agreed, it doesn't have anything to do with safety of the water. It certainly has to do with general health for children. And, you know, I'm not trying to blow this out of proportion, but when the whole dental community doesn't know, and plus they have a lot, they're busy with their practices, they have lives, they have a lot of professional journals to read. The fact that they weren't reading the consumer reports on the water, you know, is forgivable.
Yeah, of course.
And I know what that's like. So I would suggest when it's going to be this particular item, since it's the only one that if this were to continue to happen, I would like to see some sort of notification process. I don't think that's too much to ask.
So, yeah, that's a good point and it's very valid. How would you suggest, and
That you simply
Jen,
report it to the health department.
yeah.
And then we'll worry about dissemination of the information.
That would be amazing. That would be really, really helpful. Because, we now know that we are not currently feeding fluoride. When that changes, we plan on making an announcement and letting folks know it's back. And we're also trying to improve our outreach and communication around our drinking water and around the utility generally. I'll say that, when we talk to our utility service board, I think the members of the service board were also like, hey, some of us didn't read the report and they're on the utility service board. So, I don't expect your average person to have really scoured it, to read the fine print,
right,
and to also understand what it means. Which is why we did have a resolution recently to push our outreach when it comes to that annual report, because it's really important that people understand it. And then people understand not just the fluoride levels, but also the levels of other identified contaminants in their water, what that means, and what, if anything, they should be doing to protect themselves. And I would absolutely welcome and will invite all members of this board to come to those meetings, because they'll be extremely informative.
And I'm just curious, would it entail our putting before the utility service board some kind of resolution that this happened, that indeed the health board is notified and the health department is notified when fluoride in particular is absent or comes back online in our water? Does that entail a resolution, or is that something that, as the director, you can simply implement?
Oh, we can simply implement it. If we want a resolution is really just to have, when there are many directors into the future,
Sure,
and we're not all sitting around this table, that they have something to reference. It's, communicating a future plan. So I think that to me is the point of the resolutions, just like the resolution with our board. I could have said, hey, we'll just do this. And then I leave
What's happening?
right.
We know.
Yeah.
So is it your suggestion then that not only do we attend a utility service board meeting, but that we bring forth a resolution of that nature?
I think that would be wonderful. I think that would be wonderful. I don't think it's necessary to build better communication bridges between the utility and Board of Health. I think that's really important. I am happy to implement internal processes to make sure that happens. But I do think it would be nice to have a resolution. And I think that would be great to bring this board and our board together. And I think they would appreciate that.
Perfect, thank you.
Lisa, did you have a question?
No, she answered it.
Okay. And short of, I imagine this would take some time and a whole lot of money to fix.
Yeah.
What is your sense of when you can finally be done with this and you can say fluoride is consistently up to the recommended?
So 2027, the updates to our chemical building will be when I can not have nightmares about fluoride. But 2026 is when I hope to have a safe and effective temporary solution that we will have to monitor. So I'm hoping to say we have fluoride back in the water 2026, but it is a situation we have to closely monitor because there are safety risks to temporary solutions. And I know that at a recent emergency planning meeting, they actually talked about a scenario. I don't know if anyone here is involved in those, but they recently talked about a scenario where if hydrofluorosilicic acid were to spill and the worst case scenario health outcomes happened, we as a community would not be prepared to deal with that. And so I want to make sure that I'm keeping the safety of our employees our number one priority, because
Do we need such a plan?
Yeah.
Spelled out?
Yeah.
So who would be responsible for generating that?
That's
You
our
guys,
preparedness
us?
department.
Emergency management.
And- and
we have represented our hazmat coordinator is on that, attends those meetings. Yes.
Thank you. Any other questions or comments?
No, thanks for coming in.
Thank you.
We really appreciate it, and I hope you're
Yes.
not feeling too beat up about things that happened before you were even in the job, because
How long have you been here?
So I will have been officially a year this month or the end of last month. Yeah. So I'm just finishing my first year.
thank you
Thank you.
very
you
much.
so
It was
much.
nice meeting you.
Yes, it was nice
Have
meeting
a
you.
good
all.
night.
You too. And we will stay in touch.
Thank you. And please, if you think of any way we can help you, please, beyond, publicizing it somehow, please let us know. We're happy to help. Thank you.
Great evening.
Thanks.
Thank you.
Before we leave this quickly for the doctors in the room, 100 years ago, when my big kids were little, I lived in the state that didn't fluoridate the water, and they took fluoride pills. Is that still a thing? And the health department used to give them out.
Yeah.
So is that something that we can or should consider, or is that not
All
a thing
fluoride
anymore?
supplements basically, I think are a prescription item at this point, other than the things that are over the counter, which would be toothpaste, rinses, those types of things. But if you want a little higher concentration to substitute for lack of, then you have to have a prescription for that, and that could come from your dentist. So what I would suggest is, there are a couple specialists here in Bloomington that have the emails for all the dentists. So I will compose a little paragraph or two and run it by both of you to make sure it's okay. And I will notify him and ask him to disseminate that information to the
That would be
community.
great. Thank you.
So I'm wondering, since you are taking care of primary care at IU Health, and I assume that primary care also includes Riley,
Yes.
whether there is an understanding across the board that there is no fluoride basically in the water. And I would assume other than dentists, that our primary
yeah.
care physicians could
Yeah, you're
also
right.
be.
Yeah, I had written
doing
down,
Yeah,
we should do the
physicians
same
should know.
thing with pediatricians and frankly, any primary care
Okay,
provider who takes care of children.
Yay.
Then
Excellent,
we would cover everybody.
excellent.
So
Good
if you
job,
want to write it up, then I can always disseminate it.
Sure.
And
Thank
then
you.
there are some community physicians as well that we would have to get names of, Monroe Medical Group, et cetera. Yeah, Health Net, all those things, yeah.
And
I
Thank-
think Health Net currently
thank you
has
to
a
the B
dentist.
Square.
No, they don't, which is why,
Yeah.
we really need to think about it. for health plans,
Because yeah, to your point, only 40% of kids will go to the dentist, so getting with the pediatrician office is going to be really helpful too.
Okay. Thank you to the B Square for bringing this to our attention. Thank you, Steve, for bringing it to our attention last month, because I think this was really productive. If people don't mind, we have someone from the health department under new business that I'm sure would appreciate being able to go home and have dinner. I'd like to move an agenda item
They're gonna torture him.
for new business to right now before we do the department updates.
Get the hot seat, Mike.
Yeah, hit the hot seat there so the owl can capture you.
Thank you.
And he wants the guy from food to have a meal. I don't believe this.
Mike, why don't you introduce yourself?
Mike Azimka, Environmental Health Director at the Health Department. Nice to meet everyone. Earlier this year, the Indiana State Administrative Food Code was updated. We've been working with legal to reflect those changes in our county chapter code 341. Some of the biggest changes are the way we note violations. So we're moving away from critical and not critical to core, priority, foundation, and priority. So we wanted to bring it to your attention, those amendments, before we bring it to the commissioners. So if you have any questions or
Yeah, can
comments.
you explain those?
Yeah, core is anything that's doing general sanitation. And then priority foundation is supporting those controls. So for example, a priority foundation is like a food manager that doesn't have a valid food manager certificate. A control is like a bulk foods without a cover. And then a priority is like chemicals stored above like ready to eat foods, food contact surfaces are stored with bulk foods.
Like spoilage.
Spoilage?
Yeah. What would that be? Spoiled food.
Spoilage, so it goes past the date, it's gonna be a priority foundation because after 24 hours, it needs to be date marked for 7 days to discard. Then if it goes past that, it's gonna be a priority.
Because I just need to know whether I should eat there or not.
Well,
You know, we used to get those reports.
I was actually gonna bring that up after we did this, because I think it's important, but on this document that we have, the things that are highlighted are those things that you're adding and we should pay attention.
Those are the
to.
changes and some of the definition changes. The big ones are like the definitions for the violations, like core, priority foundation.
Okay, thank you. Does anybody have any questions looking at the document and seeing the highlighted areas that Mike can answer for us?
Then also we added in there, beforehand, we were doing physical reports and passing this out, but we moved towards digital, so that reflects those changes as well.
So we get motion to accept the changes.
Yeah, if everybody's finished reading, we can have a motion to
See, this,
approve the changes.
we had this stuff. Right? Sorry, didn't I read this?
Yeah.
This is
Yeah.
not different than what I read.
Yeah.
Your homework.
We don't know what the difference.
I make a motion to adopt the amendments for the Monroe County Chapter Code sections 341-2, 341-5, and 341-8 as given to us.
Second.
All in favor?
Uh,
Any opposed? Okay, motion passes. Now, before you leave the hot seat,
Yeah.
several of us really used to appreciate those monthly or every other couple of weeks lists that would come out in the paper version of the HT when there was such a thing, listing the code violations because it helped us understand where not to eat. And those haven't been published for a really long time. And we would love it if they could be put on the website or sent to the newspaper or something. What's
Or sent to B Square.
Yeah.
The biggest change is with the way we're noting those violations. It was critical and non-critical before. Now how we're entering them in is core, priority, foundation, and priority. So the way that information goes to GIS and it's populated on the website, it's kind of under construction right now. So we're working on making those updates, and hopefully it'll be updated soon with how we're transporting our access information to the new server.
But will it be published in such a way that a normal person can read it without, because I actually tried to look something up because I got in an argument with the food server once about how dirty his place was.
Yeah.
And I tried to look up when it had last been inspected and it said, oh, well, we have a report from 2004. Well, that doesn't help. I'm sure you have done
Yeah.
an inspection more recently, but and I had to use this GIS thing, which is always horrible. So I guess as an older person, I'm asking, can you just publish the list when
Yeah, I
you
think
do the
consumers want-
inspections? I think
look like
consumers,
those.
I
We
think
do,
it
I
would
do.
be easy for them to
I would
read.
say the more we use the GIS, the more user-friendly it becomes, but I can speak with the foods lead and Lori and see what we can iron out. So
Thank you.
So in doing the GPS, is there a way of making the bad guys red and the good guys green and the yellow being the cautionary, do it at your own risk, so that then we could go to one of them and say, oh, that's green, I can go there to eat. Is that possible?
like on the website or at the facilities themselves?
The website.
color code, maybe we can potentially work on that. But I know if you dive into the report, like the chunk of the important information is there, so.
Yeah, I just, it's like,
But no,
make
color code
it
is
simple
more
for
friendly.
us old folks to, identify where we can eat and where we can't.
This is just an aside, but I would love to see the system they have in California, A, B, C letters right in the
Oh,
front
yeah.
door.
Give 'em a
of the
grade.
Like a
restaurant.
grade?
Yep.
Yeah,
Oh.
If you go to a dining place in Illinois, they do like a red frowny face if it's not good, like a yellow like mute face if it's okay, then like a green smiley face.
so should we bring that before the,
Well, it's for the general public too.
yes,
Right,
Yes.
right,
yeah.
right. And I have had questions, when I tell people I'm on the board, that's one of the first questions they'll ask me is, well,
Yep.
where are those reports I used to read about the restaurant inspections?
I mean, do you remember there used to be one restaurant that consistently, well, they held some of their products were held at temperatures below 140, I believe, but now what, in 140, what hot foods are held at for some.
Hot holding 141 or above.
Yeah, right.
Unless I.
Well, there were some that were, it's like every time, or they repeated violations for that. And, that
You knew not to go to that.
presents a problem.
But if anybody from the Board of Health wants to visit the Food Protection Division, Alyssa and I will definitely like to show you how to navigate the GIS system, especially when it's working,
Yeah, but
when
we
it's
have
not under
to-
construction.
But we have to help the entire public know what is and is not safe for them to consume and where. So it's not just about us understanding.
Do you
it.
guys ever have to close a restaurant? Have you ever had to close?
Yeah,
Oh,
yeah.
Are those available to us? Restaurants that are closed?
Oh,
They're closed, they're closed.
They're
Well,
closed.
because if you look, you close, but then they do,
yes, another.
they do it,
respect.
in your mobile phone. You come to the back door and pick it up.
Ooh. That's
Well,
legal.
that needs to be
Yes.
reported.
Yes.
Well, that's a whole different issue though.
Yeah.
Yeah, that's-
Yeah.
It's a lot, but it
They're
happens.
bad actors and everything.
Well, thank you very much.
No, thanks for having me.
Oh,
See,
okay.
Mike.
I like the color code.
Before I turn it over to Lori, I want to thank Lisa, Sarah, and Lori for all of their work this past week, because it has been a week and it has felt like every single day of a week. It's felt like a year. Working on the budget stuff. And I also want to recognize that one of our council liaisons, Peter Iverson, is attending virtually. It does not look to me like our other liaison, David Henry, is attending. And thank you. I appreciate you being here, Peter. I also just want to acknowledge, having watched most of the budget meeting on Tuesday, not all the budget meetings that have been taking place for a month, but I can't imagine how hard the job of the council is to cut all of this money while at the same time trying to preserve jobs and not cut services. So just by way of preparing all of you, when Lori goes over our budget, there may be some screaming, there may be some hair pulling for those of us that still have hair left. It's pretty amazing. It's going to be hard. So there you go.
With that said,
With that said,
I was going to also highlight at the county council meeting this week, we did have 3 grants that were approved. So for public health emergency preparedness, so that's $20,000 for this grant cycle. Harm reduction funding, so that was right around 70 or 71,000 for a 1-year term. And we finally received the additional disease intervention funds. That was right around 58,000. So that grant is now roughly over $300,000 supporting 4 positions. And that will go until that will finish in February. So the 4th DIS position, disease intervention specialist position, has been posted on the county website. So that's 35 hours. That is a Pat A position. The in addition to the harm reduction grant term, that term was extended until 2029. However, that $71,000 will really only last us probably until around November of next year. And it's unclear whether we will receive additional grant funding to continue supporting that program or that position. Then moving into some of the other budget items and some of the previous shifting around that we've done with funds. So earlier this summer, County Council approved to move the IU Health Nursing contract along with nearly every Health First Indiana funded position to the County Health Fund. So this was due to legislative changes that state that funds may only be used for Indiana residents lawfully present in the United States. And as we learned at the meeting this week, all of the positions except for 2 environmental food inspector positions and the administrative assistant position have been moved back to Health First Indiana funding. So we've been slowly implementing these changes with the positions that have remained in Health First this year, along with the services and supplies and some of our contracts, obtaining and verifying Indiana residency and lawful presence. But we will be doing that department-wide. So essentially, every single person who is receiving services through the health department will have to provide proof of being an Indiana resident and proof that they are lawfully here in the United States in order for us to provide them with services. The originally proposed 2026 budget amount that was being requested after removing the roughly $783,000 that was vaccine reimbursement funds was right around 1.5 million. After the county council action on Tuesday, the new health fund budget for 2026 is $653,913. So that's really all I had.
I also just want to put in an aside, we talked about this at other meetings, that the information Lori referred to that the state is requiring about citizenship and residency has been posted on our website for quite a while. So it is public facing. So
Can I ask a question about that? So if we have a person living in the county who has active tuberculosis, and they're uninsured, and if they're not citizens, what do we do with an active TB case for a non-citizen who's walking around Kroger?
that is the dilemma posed by this legislation, because as you know, all local health departments have a legal mandate to control communicable diseases. So if we perform one of our legal duties, we will be in violation of another law. And just this week, some of you received what I sent to our county attorney suggesting some ideas. I also wrote to both of my representatives describing the dilemma. You know, we shouldn't be put in the position of
One or the other.
one or the other, because we can't do both at the same time.
So the sentiment from the council was, from our liaisons outside of the council meeting, was that we would just have to talk to county legal to get advice as issues come up.
On a case-by-case basis.
And their thought was, well, maybe this might occur maybe once a week, if that, or a couple of times a month. And they wanted some kind of numbers. I mean, we don't currently have those numbers. We haven't been tracking that.
So what's the difference? How many times it happens? Well, it only happens once a year, right? It's still you can't have a person walking around with
emergency,
TB.
right? So at this point, we are instructed to talk to county legal.
Each time.
And
Which is, I imagine, what we would do. And we would probably make a case for the situation being a public health threat. We would probably make the case for our needs
To protect
precedence, to protect the public. But who knows? That hasn't come up. We can't answer.
Well, I mean, I can certainly I can say that one of the significant ongoing TB cases, active TB cases that we've had this year came from another county, actually came from out of state, came to another county in Indiana, then came to us, went back to another county, was supposed to go back to another state. I mean, and I know what our public health nurse was doing to track this individual to make sure that he was taking all 3 of his meds every day. And when she would lose him, you know, we found ways to locate him again, to get him back on track. We have another individual who again has, I don't know what her legal status is, but another active case, which again, you know, a lot of folks come into this community, and we know that there are a lot of latent TB cases that we would like to follow that are at IU. And unless they agree to being treated and checked, we cannot do that. So we have problems all the way around, particularly in terms of TB. That's all I can really tell you from health officer's standpoint.
So I believe, are these printed copies, but they weren't in the packet because they came out so late?
Yes.
So if folks wanna, if you haven't seen, this is, after the council meeting, if anybody wants to see those, what happened with our budget. The other, probably one of the big items was last time we discussed money that we had in the COVID supplies line and our plan to purchase a mobile van and how we were going to use that. Well, we had a nice couple weeks of thinking that was going to happen because,
I think that money was earmarked for certain things.
well,
I mean, I thought it was clearly stated when we got the money that it was stated for certain things.
as a surprise, in the council meeting on Tuesday, Councillor Henry brought up that fund and requested that what I'm calling a forensic audit be done to determine, since it was COVID money, if any of that needs to be paid back to the county. So we are waiting presumably for the results of such an audit going back to 2020, probably 2021.
In the meantime, they took it. Right.
They took it. It is set aside. They didn't take it. And if Peter wants to say anything, it seems to me it's in limbo. It's like, it's sitting there.
We can't use it.
We can't use it. But so they did take it from in the sense of we can't use it. We can't buy the van, at least not now. And then presumably someone is going to look at what expenses were paid for using local dollars. And
my understanding is that a forensic audit will take over a year to complete. So we won't be seeing that money for a very long time if we ever see it again.
Does that have to be done externally?
I assume,
No,
I don't know, but maybe
Peter,
Peter, you speak to us about
do you know anything in answer to this question, or do you want to say anything about this that would help us understand?
I think the best thing I could say right now is that we set that line to $1. No budgets are final right now. So that can be changed at our meeting on the 23rd. That can be changed at the public hearing on September 30th. And that can be changed anytime before our budget adoption on October the 14th. All of those meetings are on the county calendar. You know, what Councilmember Henry has in mind for an audit, I can't speculate. But if it's going to take longer, like a year or so, I think then we need to revisit this. I know that those funds we had talked about using for a vehicle, if I'm correct in my memory.
Yes.
I
Yes.
had a long meeting the other night, so I need to be double checked on everything.
You really did, yeah.
So I think at this point, from my standpoint and from where I sit, it would be really nice to know if that vehicle is allowable, given the purpose of those funds. And, if that is something that can fit into that line. We're really up against a timeline here. And so, like I said, budget adoption is October the 14th, and that's kind of the deadline, I think, where we need to figure this out.
Thank you. Thank you. That's helpful.
Do we know where the source of those funds came from?
It was most likely all of the federal dollars that went to states for COVID. And so it then became state money.
It was their vaccine reimbursement, so like typical vaccine reimbursements. So my understanding, and I came in late to the game to all this. So I received an email with a spreadsheet of all this money, and I'm like, what's this? And so started, trying to dig around. So when my understanding is the state was helping to do billing for the COVID vaccines. There was originally one organization, so Viper, I think is what it was called, and then a Zotec, so two different ones. So they were covering the insurance reimbursements, and then this was coming back into the health departments. So it's supposed to be treated similarly. It does stay in the county health fund into 1159, like our VaxCare reimbursements that we get. So it's similar to that.
Thank you. Thank you. I was wrong then. It wasn't the federal money.
May I ask Peter another question? Peter, oops.
He'll come back. There he is.
Peter, can you tell me if indeed council orders a forensic audit of this funding, does council pay for that forensic audit?
That is a very good question. I've been on the council for, let's see, I'll be on it for 6 years now. We have never done something like a forensic audit. This is very new to me. My presumption is that we would have to see what exactly is entailed here. My assumption was that we were looking just for these funds for this budget. And again, adoption is the 14th of October. So if it's going to take longer than half of a month, then that doesn't seem very useful to me.
And we do know that our department has been meeting with the auditor's office and basically doing forensic auditing of all of our grant funding. So I'm wondering whether, in your understanding of what Councilman Henry was proposing, whether this would fall under that, or whether we are genuinely asking for an outside forensic auditor to come in, which is, I understand, is not only laborious to go through all of our auditing, all of our books from whenever, and very expensive because it's at least a year's worth of work.
That's my concern. We're spending money on an audit that
Yes,
could be spent on healthcare.
yes.
Also, forensic audits, are basically saying, we believe some law has been broken.
Now, that was my term. That was absolutely my term. And
Okay.
I only meant it to do a look back.
Right.
Which was what it sounded like he was saying, going back to 2020. Did the county use, for example, rainy day funds for COVID that they should be reimbursing themselves with? So I don't want to put words in anybody's mouth. That was my word.
So it may well be that what we have already been undertaking with the auditor's office, going back to all of our grant funds, back to 2014, and who knows beyond that, suffices for what Councilman Henry needs to be.
That would be different. I mean, the amount of, if you look at the DLGF, the amount of funds that came through the county health department for the budget that was dispersed was 4.6 million in 2020. So that audit process would be totally different than what we've been doing.
And now I don't want to put words into Councilmember Henry's mouth, but let me just repeat. We are talking here about a vehicle to help you fill your statutory requirements. And I think in the short term, we need to figure out if that is an allowable expenditure and move forward with the budget in that way. And then Councilmember Henry can come and talk about what type of audit he thinks is necessary for those funds.
Thank you. That makes sense.
Thank you,
to
Peter.
us.
Thank
We-
you.
We appreciate you being here.
It's my pleasure.
Any other questions having to do with do we want to talk about the 23rd and the plans we had
If you'd like.
at all? So remember also at our last meeting, we talked about what we felt we needed for positions to perform communicable disease case investigations, take up some slack with vaccinations, and do the school health liaison work that's required by Health First Indiana. And we just, again, thanks to the help of these guys, we just submitted the request to council this afternoon. It will be on Tuesday's agenda, Tuesday, the 23rd. So if anybody wants to attend, please do. We are asking for one new position that will be called a public health nurse that will have primary responsibility for communicable disease case investigations, scheduling vaccine clinics, doing the outreach on the van if we're lucky enough to get it for clinics, and taking the lead on the school health liaison work that we need. And we also have a request in to revise 2 positions to be backup to that effort, so that if we have a surge of disease and they need more help, we'll have people already trained and it's in their job description. Or if that lead person gets sick or goes on vacation, we'll have people that can step in. So it's pretty much what we talked about a month ago. Are there any questions about that?
Just had a question. I know that Kay was concerned because we lowered the salary range was so low that we couldn't attract a nurse. Is that's still the case that we hired an EMS?
It is a PAT D. Our request is a PAT D, which is the same level as the Director of Health Services, which is what went through WIS, and that is at a nurse level as well. So this will be minimum LPN.
Having taught in an LPN or I was over an LPN program and an RN program for many years. That's not in the LPN,
Just as a.
they're not taught in that area, they're not.
We are
Yeah.
going to have to train that person. But we're gonna have to train any
person goes into the.
any person we get. We're gonna have to train them in basic epidemiology.
But they don't have that training.
No.
That would be putting them through a nursing school.
The
Outside
Nursing
their
Practice
scope,
Act
outside
doesn't
their scope.
recognize
Yeah.
that for them.
They wouldn't even be
Always.
covered by malpractice.
That's what public health nurses do
Do.
all around the country. That's what they do all around the country, and they're
They are not
and they
taught
RNs.
public health.
Exactly.
PM.
And that's why they have to be
That's why they
specially
be
trained
in a training program.
once we get them.
Just like our DIS.
Yeah.
Our DIS come to us with all different backgrounds. Some of them, no medical background, degrees in psychology, degrees in business. I mean, and we spend the time training them in epidemiology. We train them how to do venipuncture.
Legally, they practice, and they practice under something called the Nurse Practice Act for the state to get their license. It does not recognize those kinds of things.
They're not licensed independent practitioners.
Right.
Right.
They're not going to be independent. They're going to be practicing under orders.
Yeah.
Of the health
Standing
officer.
orders of the health officer, which is what they do now.
Mhm.
My orders stand, and yes, we already have an LPN who does part of our public health nursing, so she is under the same orders that this individual or individuals will be under. It's just, it's how it works across the state, unfortunately. And yeah, it'd be delightful if we could attract someone with a background and interest in public health nursing who has been doing this. And we don't know that that's going to happen, especially at the level we can afford to pay.
George,
The hearing is on Tuesday, the 23rd, when and where?
probably in the Net U Hill room, 4:30 or 5? 5. Got 5 fingers.
Thank you.
5 o'clock night, you held, thank you.
And
It's
there
not
are a
much.
couple of people who cannot be there, like Lisa and I will not be there. So
Oh, yeah. Are you gonna be gone? Are you on vacation or something?
Well, I was supposed to be. If I can come back.
Oh, my goodness.
I'll
We'll talk
stop
about that
by.
offline. We'll talk about that offline. You're out of the country. Oh, this is just wonderful timing.
they're
Like,
dropping like flies.
Every time I had
Yeah,
vacation.
Yeah.
yeah. Okay. Oh, I'm sorry. Peter, did you have
I
a
simply
question?
wanted to mention, as of right now, the draft agenda was released yesterday. This is item 9G on our agenda. So
Thank you.
if you're more than welcome to come at 5 o'clock, or you can come a little bit later. It's in the middle of the meeting, so.
All right, that's good, good to know. It sounds like it might only be me and George. I mean, I don't know, because everybody else is gonna be gone.
Can I maybe
Yeah,
talk about one more
please.
thing? Peter, since you're here, so some of the changes with the 2026 budget with some of the positions. So I
Mhm.
think my biggest question is, can we make modifications with what positions can remain in 1159? Compared to what is there currently? Because, for example, right now, we don't have any positions from vital records. So we do get out-of-state individuals who are born here. It would be ideal if we could still at least have one person in vital records who could then do the services for those individuals, rather than we will have to refer them to Marion County. Same thing like with our wastewater. So we have backup coverage in each of these areas.
This legislation is causing so many headaches. Oh my goodness.
Yeah.
So the quick answer is we can look into it. I mean, right now, I think we need to talk about it and which positions you're talking about. I'm not looking at the cumulative budget, but let's talk about it. I mean, because again, you all are the experts. So I'm just the fiscal guy.
Yeah, I mean, I really think that for our department and our community, having at least one person in each of those areas in environmental and at least one in vital records, if not two, still in the county health fund is really necessary. If we have someone come in, for example, for a septic permit and say they just refuse, or they say, no, I'm not, then we're in the same type of situation to where we cannot provide them with that. And so having an option of having a person to assist those cases is really, I think, necessary.
Yeah, Ms. Kelly, if you could send that request to me, your liaisons and Kim Shell, and indicate which specific lines you'd want to address, that would be really helpful.
Yes, I sent that to Kim earlier this week on Monday. So
Good.
you
Okay.
all, yes, should have that.
All right, great.
Thank you. Thank you. I think we're ready to move on to old business. We have an agreement to approve, which was in your packet. Does anybody want to speak about this?
So I would just encourage us to vote it down, even though this is a fund that Steve and I have been working on. The reason is because it will add, if you look at the laws that surround pass-through agreements like this, it adds and the city, county may be required to do this. It adds the auditor's office and it adds the county council as being approval bodies for it adds it as a line item to our budget, essentially, that they have to account for, she has to account for. Whereas the intention, at least of me, for this fund was to reward our employees quickly with tokens of our appreciation for their service, to help them get further education, to travel to a meeting that they couldn't afford to go to otherwise. that would give her some latitude to do that. But it sounds like it's going to be more complicated than that. And so I would recommend we vote it down. And I haven't talked to Steve about this except for now.
Briefly, talk to you.
Briefly.
Yeah.
But that may be a different mechanism. So for instance, we could do it in a different way that would involve all the layers of government. Like we could get a list from her once a year about people who have made requests, and we could reward them individually outside the department and send them a check from this fund to fund whatever education they need, or to fund their recognition, or whatever the administrator feels. That would not involve a pass through, because it wouldn't be money held by the county.
Just as a little background, just to make sure everybody knows, Lee and I set this fund up through the Community Foundation. It's a tax deductible fund. It's called the Ad Meliora Fund, which means for better things. Thanks to his wife, he named she named. And it was really originally set up to reimburse people in the department for things that weren't reimbursed through normal channels, through the council, through grant, things that we would normally have as a course of matter, they would be reimbursed for. For instance, we had recently had a board retreat, or if you want to call it that. And that was in August, and it included lunch, a day at Cascades Park. There was an agenda. Departments were reviewed. There was a program, and this fund paid for the food, the shelter house, and anything else that had to do with this meeting. And the employees enjoyed getting out of the department. It's nice to not see the same four walls all the time. Trust me, I know 43 years of looking at the same building as a dentist. So we set this up, and it was an intent that people could donate to this fund. That would be for the betterment of employees, and this was a private donation. So we don't want county involvement in a private fund. And I'm not sure and I thought we cleared this with county legal. I know he saw the document prior to this, but now, here we come back around, and my concern is this. And our concern is that if we pay for something, will the powers that be simply deduct that from what they would normally be giving us? And I don't want to sound like we just trust people, but it seems that money's being taken away, and I know that part of it, the money's being taken away now, is the council. I think is agonizing over much of this. I don't. A lot of it's mandated by the tax levies and things like that they are what they are. But we prefer to have this taking place as private citizens, private donators to the department, and they can be reimbursed directly for legitimate expenses, which of course they would show receipts and provide an explanation of what it was used for. There is a list of things that this could go for that had to accompany when the foundation paperwork that we had to turn when we turned this in. So now at least you have some background about what's happening. So I go.
So to be clear, our vote no is to allow you to continue to have control of the funds ultimately.
And use it,
The way
the way it was intended,
it was intended.
which is, it's it's a long list, but you have to have something on that list to justify the money. It's not something you can buy booze with or do anything crazy with. So, it's not something that needs an additional sets of eyes looking at all the way up and down the food chain of the county. So,
Plus the county, the community foundation has a board that reviews each grant. That's what it's called. And any kind of reimbursement is called a grant. And they review each one of those things and the paperwork they accompany it. And they actually have the right not to approve it, if they don't think it fits the parameters of the original documents. So.
Anybody want to make a motion?
I move that we not sign this agreement.
And I'll second that.
All in favor?
Aye.
Any opposed?
I would thank Lee and Steve for their
Yes.
hard work,
We tried.
frustrating efforts, and urge that whatever the successor fund turns out to be, that we contribute to it to aid our loyal employees.
Yeah, we certainly accept, since we're all retired IRA, you can go write-offs.
We have one more item, which is board member and health officer comments. Anyone besides me? Should I just go and get out of here? Okay,
I do want to say, and kind of referencing what the director was saying, is that, some of the council meeting felt attacking towards Lori, and Lori inherited a department post-COVID and a lot of things that she was unaware of, and so she inherited that to guide and try to go back and fix things. So I just want to say that she's done an excellent job, and her job currently is a lot of things that she inherited that she has tried to fix, and her intent has been good. And so I just wanted to put that out there.
thank you.
And I'll second that and say that what I discovered is that indeed, one of the ways that Lori felt hurt and offended by a council member comment about the fact that she did not take the financial manager with her to budget meetings is that financial managers did not exist when you came on board. They never existed at the council. And so to expect you to know that now they would like for you to bring a financial manager, which was not a position that existed, with you, was just unfortunate, an unfortunate statement. And I hope that you will take it with the grain of salt that should have been tossed away over the shoulder. So I really, Lori's been, once again, has been a rock star through this extraordinarily difficult time when we've gone from one horrendous experience to the next, to the next, to the next. And we are working incredibly hard to make all of this still work, and for us to be able to serve the public in the way that all of us intend for this department to serve.
Thank you.
Say one quick comment,
You go.
since I've done already a lot of talking. I want to clear up or provide a reference for, as everyone here probably knows, our arrangement with the public health clinic is changing this year. We'll no longer be partners with IU Health in a formal way. We've had a contract in this county for as far back as anybody can remember.
60 years.
Yeah, okay, so and they informed us in August of this year that, well, actually it was Denzel Ross, who is the vice president for IU Health for the South Central region, informed us at that meeting that IU Health would no longer be treating us differently than every other county in Indiana. And so we will no longer have an official contract that we pay for them to provide our vaccine services and
communicable disease.
Yeah. So, if there is any misunderstanding that this somehow there's more to this story, or we did something to bring this about, you may contact Denzel Ross. I don't have his phone number, but you can get that, I'm sure, very easily online. He's the vice president of IU Health for this area, and he has the information and can explain the rationale, which he explained to us, but I've kind of shut down when I first heard this because I think my mouth dropped open because we were not expecting this. And they allowed it, and that left us only 4 months till the end of the year to try to do something that, has been there for 60 years. And it's just like, I don't know how we're going to do it. I mean,
We're
quite
just
frankly.
pushing through.
We're doing the best we can.
We're just pushing through. We're just gonna get there.
And they're providing a mandated service in disease tracking, and we don't have someone on staff that can do that. So,
But
Yet.
hopefully we will soon.
And we know Peter's gonna help us get that done,
Remain optimistic.
Yes.
right, Peter?
so anyway,
I am a politician and I make no promises.
yeah.
Thank you, thank you.
Smart man.
Lastly, you all will have seen in your packet, you have a provider fact sheet on Chagas disease, which comes from me because I get emerging infectious disease news. I know. But here's why this is important. It's not important today, but I wanted to get it on your radar for future because the big news to infectious disease nerds is that this has been made an endemic disease in the United States, which I read it and I went, what? Because it had always been endemic in Central America, South America, because this particular bug needs very, very warm conditions. Well, thank you, climate change. So we are seeing more cases now in the southern US. And because we're in southern Indiana, we are going to see this before Elkhart, which may not way too cold up there. We may start to see this before anyone does. There have been cases, not human cases, as I understand it, reported in Missouri and Tennessee. So it is creeping up the turnpike. It's creeping up the road to us. We may have to deal with this soon. I wanted you all to just have some information about it. And if you want me to send you the article from the Emerging Infectious Diseases Journal, I am happy to do that.
It's been on Facebook for some time.
Has it?
Yeah, they don't call it Chagas disease. They talk about the kissing bug.
Yeah.
Don't touch it. And,
Yes. Yeah, well, it's a real thing and it has some serious health consequences for people and it is treatable. But we're going to have a lot of clinicians because they've never seen it before, because it's never been here, who are going to be misdiagnosed. And so people won't be able to get that early treatment.
We had a leprosy case in Evansville last year, which we diagnosed.
oh, wow.
Imagine that.
You don't expect to see Hansen's disease either, right? So, who would know about that?
This disease appears to be hard to diagnose. This Chagas.
Yeah, I did.
So trypanosome, you see the little guy swimming in the bloodstream.
Cool. George knows.
George will bring us some.
Okay, any other? We have a motion to adjourn.
So moved.
Second, all in favor?
All right.
Aye. Thank you very much, everybody. Good night.
So